Hi everybody, I am Dr. Zainab Vora and I have with me Dr. Brij who has secured rank 11 in NEET SS, fellow Gujju. So I'm very proud to interview him and he's done his MD from BJ Medical College in Ahmedabad. And many congratulations Brij. So tell us about your residency and your exams and then this exam. How has the journey been like?
Thank you, ma'am. First of all, I'm very grateful to be in front of you and giving a interview like this. It
Thank you.
it has always been a dream of me and all of the PG aspirants to be in front of you. And the residency in BJ Medical College was a bit hectic in first year and second year half of it, and then it is very easy going. So we get time to read. And I was very fortunate that by the time I got into second year, e-conceptual radiology was announced, and I got it in the first day I started the train, and I attended approximately every lecture I attended for the
Wow.
first year, and then I had to do, system wise.
Correct.
So I am a bit very fortunate to be given this opportunity of reading from the constitution, because this was not the case with my seniors.
Mm.
And I was very much here in BJ Medical College. We don't have enough exposure of intervention. We are only limited to superficial biopsies and sometimes sclerotherapy and all. So I was not at all exposed to interventional radiology, and I was not planning to give SS also. But
Mm.
after viewing lectures of Dr. Akhil sir and Dr. Resham sir, they inspired me to, and
Mm.
that's when I got interest. I read more and watched every of their videos, and even had the opportunity to talk with them in the crisp session. And
Yes.
thereafter I started reading about IR and then prepared for the NEET SS examination.
Amazing.
So
Yeah.
uh,
So I
that
think that's something that we also lagged as when we were doing our residency as well. Even though I'm from AIMS and we had a lot of IR, still there was nobody to really teach us in detail of what is done. You didn't have awareness whether you want to do it or not.
absolutely.
And I think
Mm,
through conceptual you get to interact with so many
mm,
different faculty who are doing different things in life that you can see what do I want to do in future. So
mm,
I think that's something apart from the academics that you get to do through this platform is just interact with different radiologists in different fields. So
absolutely.
yeah, amazing. How was your crisp experience, by the way?
Crisp experience was very nice. Actually, I wanted to meet all the faculties whom I used
Yeah.
to see on my screen,
Yes.
and I concised each and every notes of the lecture, and I read it just 2 days before exam, NEET SS examination. I also used the notes while preparing for MD examination. I think I'd advise all of my juniors to at least go once in crisp session. I,
Amazing. Very nice.
uh,
So you said that you saw almost all the lectures on the app. So how was your approach in terms of, going through it? Like, were you making notes or were you seeing and learning on the go, revising from the PDF? So how did you utilize the app?
While viewing the lecture, I used to make notes on my book,
Yeah.
and then I used to scan the notes from my phone. And I have a drive link of each and every lecture that I have watched. So whenever I am reporting any case, whenever I want to revise something, I used to open that drive link and quickly go through that lecture. So that has helped me a lot. And
Yes.
matlab, you should make notes.
Yeah,
That's
I
what I
think
am
that's
able to.
great because you
Mm,
write it in your own way, and then the next time it's just gonna take one fourth or one fraction of the time
absolutely,
that it did.
absolutely.
That's a great idea, because you're not
Mm,
just passively reading, you are investing
mm,
time and it's gonna add up in the end. Like in your case, both your exit exams and NEET SS, you would have
mm.
used the same content that you probably prepared 1 year ago,
Yes.
2 years ago.
Mm.
It all comes in very handy in the
Yes.
end. Very nice
Uh,
advice. Yeah.
That's why I was not overwhelmed by NEET SS, and my goal of reading for NEET SS was just that I should not forget what I already read. The
Yeah.
only goal was that.
Yes, and I think most of it always stays with you. As far as I feel, clinical radiology, you once read, it doesn't leave you. But
Yes.
physics leaves you the moment you finish the exam, right? So,
Mm.
so was that something that you had to prepare for again before NEET SS, and would you advise your juniors to do that, or any particular things that they should keep in mind for this exam?
Absolutely. I went through all the lecture PDFs of Nikita ma'am. They were very helpful. And I would also, as there is a lack of MCQ books for
Mhm.
NEET SS examination, my seniors advised me to, prepare MCQs from FRCR and USMLE crack exams.
Right.
So I used to do that as well. I have 5 to 10 books, and they were very helpful as well.
Okay. Yeah, that's nice because students have been requesting us to make MCQs, and I've also been struggling because I have no database as to, because like unlike NEET PG,
Mm,
for NEET SS, we never do recalls, etc., to collect the questions. So even I did not know the pattern on which lines.
yeah.
So if you can tell the juniors as to what is the pattern really? Is there a preparation strategy to this, or your overall knowledge all comes in?
Most of the part, your 3 years combined knowledge of residency is sufficient, as every NEET SS rank holder would say. And
Yeah.
to touch upon that, you also will require a bit of IR knowledge. And
Hmm.
in this, particularly in this year's exam, you also need PSM knowledge, like biostatistics, and
Yeah.
they particularly ask biostatistics questions regarding to numericals as well. So I was not prepared for that,
Hmm.
and most
Right.
of the people were not.
Yeah. So I think we can have one biostats module as well.
Yes,
Because yeah, even in the exit exams, they do pick up one question at least and ask
yes.
on that. Tell us about your theory and practical exams, your MD exams. How was that like?
My theory and practical exams were in September and October of last year,
Hmm.
and we have pretty straightforward papers. Like they
Hmm.
ask 20 marks questions, and 5 questions they ask. There
Oh,
are no options.
that's nice.
Yeah, and they usually ask entire chapters. So we
Mhm.
are pretty sorted for the theory
Yeah.
examinations, and for practical examinations also, mostly we get case which we use, which we day to day report. So
Hmm.
exams, I don't think are much of hassle.
Yes, very nice. So you must have done some research, and you're talking before we started about the list of IR colleges and how they are sought after. So if you can tell your juniors who would next year, let's say, or next exam would be preparing for this, what are the pros and cons of the different colleges for IR, if according to your
Yeah,
knowledge?
yeah. First, we have to decide if you want to do a bond or not.
Hmm.
That is a big question, because many of the colleges will ask you to do 1 or 2 year of bond,
Hmm.
and most of the colleges don't have a full body IR plan.
Hmm.
Many colleges have a good
Correct.
body IR, many colleges will have good peripheral IR, but very
Right.
few institutes provide you with full hands-on experience of full body IR.
Hmm.
So KMCH Coimbatore and CMC Vellore, even Grant and JNMC Belgaum, these colleges do provide a full body IR, but few of them have bonds like
Hmm.
CMC Vellore and the Grant. And other DRNB institutes are also pretty sought after, like Gangaram in Delhi,
Hmm.
Medanta in Gurugram, even GKNM Hospital in Coimbatore is very nice. So
Yeah.
these are hospitals we can look for.
Right. So that's the usual list for interventional radiology. And, if one is considering other options apart from doing IR, you must also have considered before you opted for this. So what are the other things that you feel are options after doing your MD?
Mm. Uh, Even in radiology, a subspecialization is is being the norm right now.
Yeah.
So fetal imaging and MSK, these both are coming up in a big way. Even fetal interventions and MSK interventions are coming up in a big way. And I think most of the tier one cities will require good interventionists in fetal and MSK
Hmm.
in coming years. So I think good institutes providing that would be sought after.
Right.
And
So fellowships basically
yeah, absolutely.
short-term training programs in fetal MSK, body imaging, so
Mm.
all of these things are something which I think my video is stuck. Yeah, sorry. So these are the things which are the most important ones. So all right, I think it was great talking to you and a lot of insight for the juniors. Many
Yeah.
congratulations and all the very best for the journey ahead. Hoping to see you soon.
Thank you, man. Thank you very much.
Thank you. Thank you for talking to me. Bye.
Okay, okay, bye.